Thank you. My topic is initial management of STMI in Bangladesh perspective. So before a presentation, I just look on the scenario of cardiovascular in Bangladesh. You know, Bangladesh, like other country, Bangladesh is the major cause of death in the already transition from the communicable to non-communicable disease everywhere in the world. In Bangladesh, you know, NCD, all death is the more than 60% all deaths. And here also, you know, hypertension is common phenomena. What are the cardiovascular care facilities in Bangladesh? Number of cardiologists in Bangladesh, 1100 approximately. Cardiac surgeons 250. Number of hospital having the cardiovascular care, 75. And number of hospital having cardiovascular surgery facilities, 33. In bracket, within a bracket in outside of Dhaka, that is 5 cardiac surgery in center in Dhaka. So in our scenario, 6.4 cardiologists for 1 million populations. 1.4 cardiac surgeons per 1 million populations. What about the cath labs? Interventional cardiology is around 400. Cath lab is 59 center. 85 cath labs in Bangladesh. 58 center cath lab in Dhaka. Surgical cath lab in 32 center in backup. IVA center only 10 center. OCD 3 center. Rota 5 centers in Bangladesh. So what can do? I think in a limited data in Bangladesh scenario, most of the patients, a single cell study shows 30 to 40% patients was acute STMI. Like other South Asian Bangladeshi people are unduly prone to develop CED. Premature coronary disease, diffuse disease is the most important in Bangladesh. Premature coronary disease, early age, younger age, and also there is severe coronary disease and long diffusion in Bangladeshi populations. We know time is the myocardium. Early revascularization is the most important key in like of low middle country. Bangladesh also is the most important role is the delayed arrival. You know, everybody, time is the important management. Is after time going the damage of the 45% in 40 minutes, 33% salvage 3 hours, and 6 hours 16% salvage. And it is most important thing is time management. So pre-hospital delay is the most common. So we are find out what is the cause of pre-hospital delay in Bangladeshi in population Bangladeshi people. Most factor is showing age, more advanced age. People are usually অনেক বয়স হয়ে গেছে বুড়া মানুষ আমার বাবা মা মুভ করতে চায় না. It is the most important complaint. And history of angina, diabetic patients cannot pain the chest pain, sometimes with the peptic ulcer disease, cannot pay attention to the physicians. Living alone, it is really trouble in the affluent society. Consultation of the private physicians and also family members. Believing symptoms are not serious and waiting for them. So it is the most self-treatment, taking the drugs. In Bangladeshi people, they show lot of antacid plus, taking the local coax, you see. And it is our scenario is the rickshaw van in Bangladesh and CNG. It is the factors of the rural and urban area both also. Managing patient relatives, it is the another problems. You manage the lots of doctors are relatives talking around the how to go the chamber. You can manage doctors are travel in Bangladesh like is very big country. You see ambulance, 2.8 ambulance per 1 lakh in Dhaka city. 4,702 registered ambulance in Dhaka city, and in the country 6,938 in the country in ambulance. You see in the Upazila hospital there is a 2 ambulance. But collapsible gate is locked. There is no driver within the collapsible gate in the scenario. Sometimes the ambulance is there, driver is not appointed there, and sometimes the petrol and octane is not delivered by the government. So ambulance is there, but there is no budget allocation for the ambulance. So why not rapid delay? So it is the factor in Bangladesh. You know, it is so many crowded over the flyover and under the flyover. So you know everybody, it is the initial assessment of the diagnosis, ECG, biomarker, analgesia, loading dose aspirin, copidogrel, supplement oxygen, and anti-anginal drug, admit the patient of CCO, you know everybody. Focus, but you know early reperfusion and pharmacological and invasive is the most important to the PCI, non-PCI centers. STMI management protocol, you know, it is the first medical contacts within the 60 minutes and balloon infection time or rapidly go to the PCI center. If not PCI applicable, we go to the nearest center within 120 minutes. It is the most important things. So deprivation can be like the invasive, maybe pharmacological, maybe pharmaco-invasive. Deprivation strategy in Bangladesh. What is scenario? Thrombolytics is totally Bangladesh is dependent on the streptokinase. Tenecteplase use are gradually increasing. Primary PCI center is few center. Pharmaco-invasive therapy is few. It is within 3 to 24 hours. Conservative injection heparin for delayed arrival of the patients. It is the most common scenario in Bangladesh scenario. Last one is the most common scenario in Bangladesh. So primary PCI strategy, you know everybody, primary PCI is better than the fibrinolysis. It is the well-documented study, all the shows. We will not talk about the primary PCI about this. But you know, already discussed, it is not possible in Bangladesh because remote location, traffic congestion, road condition, lack of nearby PCI capable center, infrastructure, time of call, night and weekends, and financial constraint, and most important, there is the coverage of health insurance in Bangladesh. It is one of the important things. So I already talked about that. What are about the cath labs? 57 in Dhaka, outside of Dhaka only a few centers. So is primary PCI possible in Dhaka? I think it is not possible in Dhaka. So right now it is not the best possible option. So what can do? What will be the patients within 12 hours? I think pharmaco-invasive therapy could be the best option in Bangladeshi population. All the study shows, you know, definition of the pharmaco-PCI, we know. We give the sterokinase or tenecteplase. Tenecteplase is the best one. After giving the tenecteplase, you send the nearest center within 3 to 12 hours, then do the PCI. Bangladesh is a very small country. You can transfer anywhere in the Bangladesh within 24 hours in the PCI capable center. But one thing is the financial constant health insurance coverage is not possible in Bangladesh. So lots of study trials, it is a pharmaco-invasive study, not inferior than the primary PCI, not inferior than the primary PCI. Flow rate is increased as same efficacy in the both trials, and without ever complication, we see the same thing. So conclusion, pharmaco-invasive therapy is compared to the primary PCI is but what is the problem? Limitation, what is cost is doubling because tenecteplase is price and plus the PCI cost is doubling in lots of cases. So it is the need and need more the RCT trials to see the outcome of the pharmaco therapy. So what can we do? We cannot do the primary PCI. What can do? We can use the latest thrombolytics. It is possible. We can force the government to supply the latest thrombolytics, which is the tenecteplase, can supply the government to any center. So use the tenecteplase. It is the better option. So all the studies shows that tenecteplase is one of the option to give the successful. You say tenecteplase is the flow rate 96.54%. So tenecteplase outcome is better than any other study. So my take-home message: we should the public awareness regarding the ECS, development of the ECG interpretation by the teleconsultation at primary health center. We can the consultation of our junior doctors or health providers do the double ECG interpretation. Extending of the NCD centers in all secondary health centers with necessary equipments. Periodic training of the health professionals. Establishment of CCU with latest thrombolytic therapy facility all district hospitals. Active cardiac ambulance facility in all secondary health centers. Establishment of the cath labs in all divisional hospitals with 10 manpower. Pharmaco-invasive therapy may be the best option. And last not least, health insurance coverage improve this is outcome. Thank you for patient hearing.
Thank you, sir, for your brilliant presentation.